No.
Okay. All right. Well, thank you very much, everybody, for coming to this question and answer for the 2023-2025 SMAC program. My name is Matt Callison, and thank you so much for Patricia Botet, who's our Chief Administration Officer, for being here, Autumn Kiergan, our social media manager, and also Brian Lau and Ian Armstrong, who are on faculty of the Sports Medicine Acupuncture Certification Program. So you guys, thank you so much for coming here on a Sunday. That's above and beyond. So thanks again. We'll try to be able to get a lot of these questions or all the questions answered. And so we can finish up and then continue with our day. Now, I've made a bit of a PowerPoint that hopefully will start to answer some questions as well. It'll be a short PowerPoint, and then we'll go right into the questions on the back half of this meeting. So why don't we go ahead and get started with that? I'll go ahead and share my screen. All right, so the certification program is 270 hours of advanced sports acupuncture training. That's going to be from Module 1 all the way through Module 4. Now, it's beginning in September of this year with Module 1. This particular program has evolved. This is now going to be our 15th program, actually, that we're going to be running. So we've been around for quite a while, and each program continues to evolve and become more and more concise. And we do listen to the students and their feedback. So each time we try to be able to make a better and better coursework that people can understand and efficiently apply it immediately to their practice. So this next program is the new and the best of SMAC, is condensed in a simplified form. We're going to go into a little bit of the descriptions of the different classes, the postural imbalances and acupuncture protocols. The next class being myofascial techniques and therapeutic exercise. Then after that would be your assessment and treatment of injury. Each one of these classes are a standalone class. The individual who is taking this class can be able to learn quite a bit just from that one particular class, but the way it's designed is sequential learning. So classes can also be taken individual for CEUs or PDAs. There are a number of different people who will actually come in and just take the assessment and treatment classes or the myofascial classes. For example, we're getting more and more OB/GYN acupuncturists that are taking our Module 2, low back, hip, and groin, because by balancing the pelvis, you're balancing the Chong Mai and the Dai Mai, and then getting very good results with OB/GYN signs and symptoms. So it's interesting to be able to see the different acupuncturists from different fields coming in and learning how to be able to treat the myofascial systems, which, as we know, will also affect the internal environment. So again, the registrant can go ahead and sign up for the entire program if they want, or they can just take individual classes. We offer both. Now, what we did do in the last program, actually all of the programs, is that we had the cadaver lab in Module 1, 2, 3, and 4. With this, the cadaver lab was very, very useful. Brian and I would do the dissection with that, and then we would show the participants the underlying anatomy and needle techniques and the myofascial sinew channels, motor points, and such. The practitioners themselves were not able to dissect. In order to decrease the cost of the program, we have eliminated the cadaver lab from the SMAC program. However, we are having 3-day cadaver lab for the acupuncturists taught twice per program year, and that's going to be held in Bradenton, Florida at the Dragon Rises College of Oriental Medicine. Those dates will be announced shortly. We're just getting some of the remaining things going on with the venue, and we'll be able to announce that very, very soon. You do not have to take a cadaver lab for the certification. That is something that we decided not to do in order to be able to decrease the cost of the overall program. What we do highly encourage for people to take this, because you will see your patients in a very different way once you experience the cadaver lab. It's absolutely amazing. You can always go to the reviews of that as well. That's on our website. In addition, a lot of people think that this SMAC program is just for athletes because it is sports medicine acupuncture. Well, Sports medicine can actually be applied to all different age groups and different populations of people. In this next slide, I'd like to have you watch a testimonial from Carrie Sawtell, who just graduated from the program. And she actually started as a community acupuncturist. Then after finishing during the program, she decided to start treating private practice. And most of the people that she's seeing are in the 60s and 70s and really not that fit, but she's still able to apply the assessment and treatment techniques. So let's check that out. You don't want to do it? Can't advance the slide? There we go.
I'm very excited to be taking sports medicine acupuncture classes here in San Diego with Matt Callison. I have found over the past 2 years, as I've been taking these courses, that I've been able to apply so many of the techniques to my patient population. Even if you're not working with athletes, let's say your patient population is more elderly or sedentary, I found that you can apply a lot of these techniques to increase their proprioception, to get them more active, healthy, and have a much better quality of life. So I highly recommend these classes.
It was kind of funny when she was shooting that video because the airplane was just going over. She was trying to be able to finish real quick. And I think I can be able to speak to Carrie that when she said it was Matt Callison, she's also just speaking collectively for the entire faculty because she's taken the entire course with the different teachers as well. So again, sports medicine acupuncture certification program can be applied to different age groups and different populations of people. The class that we're just creating right now called Posture Imbalances and Acupuncture Protocols, this will be the start-off class. This is a class that's going to be teaching postural assessment, looking at the imbalances and why these imbalances are creating the person's musculoskeletal injury by explaining to the patient why they're getting low back pain. Let me show you. Let's see if I can get a little, let's see here. Get a little cursor here, laser pointer. All right, by examining, let's say this person is coming in with an elevated ilium here that you can see the cursor there. The person might be experiencing low back pain right at Yaoyan region. Or perhaps because of this elevated ilium, you can start to see how that spine is going into a curvature and then potentially being fixated, a hypotonic region within the spine, therefore decreasing the amount of chi to the middle jiao and why they're coming in with digestive disturbances. So the sports medicine acupuncture program is not just treating the meat suit, so to speak. We are observing what's happening externally is going to affect internally. And by treating the internal, it's going to affect the external. This is very much TCM, and this program is rooted in traditional Chinese medicine. By looking at that posture, we can start to understand what's happening to the external environment, but also what is potentially happening to the internal environment as well, especially like with that example I was just talking about, this area region right here, innervating the middle jiao, decreasing the trophic factor, the chi of the nerve going into those organs, and why this person may potentially be having the digestive disturbances, which actually was the case for this particular patient of mine when I saw him in New Zealand. Or perhaps this patient is coming in with occipital headaches, and we can start to see that his head is actually turned to the right, has a little bit of a tilt that can cause lock short tissues within the suboccipital triangle. That could be potentially causing those headaches, those cervicogenic headaches. But at the same time, because it's going to end up affecting that gallbladder channel, what is happening with his actual gallbladder? So we look at the signs and symptoms with that as well. Now, we can also look at, let's see, is it going to work with this? Functional movement. No, I'm going to have to get rid of my cursor, I think, to get this video to play. We can also look at functional movement and see why is this patient coming in with low back pain. So in this particular, sorry guys, so in this particular movement of an overhead squat, we can see that the pelvis is really starting to deviate quite a bit to one side. She's having a hard time with that squat. This is the type of movement pattern that you'll see with low back pain in addition to sacroiliac joint pain. So this is telling the practitioner quite a bit what's happening with an elevated ilium, which way the pelvis is going to be shifting. And then that also gives us a treatment protocol with acupuncture as well as with exercises and myofascial work. So we're looking at movement patterns, static assessment, getting an idea of the overlay of what's happening with this patient, discussing with the patient why they're having this pain, and then we apply to our diagnosis, not just Western sports medicine, but also TCM, why this person is having those injuries. Apply acupuncture to it, also myofascial work, and also exercises. So the myofascial techniques and therapeutic exercise, this is our second class. This is a 2-day class. The first day is going to be the best of myofascial techniques that we have taught in the SMAC program. And then the second day is going to be the best of therapeutic exercises. The myofascial techniques that are taught in this class are primarily from Brian Lau, and his training was structural integration. And he's had a number of great teachers over the years. And he has modified techniques also just based on his own clinical experience. So day one is going to end up being that. Brian, do you want to share some thoughts about the efficiency or the efficacy of using myofascial techniques after acupuncture? You might be
Yeah,
muted.
sure. It's just, multiple ways you can do it. I, to be honest, sometimes I do them before the treatment, but we usually teach it after. I think after makes a lot of sense, and especially consistent is useful to be able to organize your treatment time. But it's nice in the sense that they reinforce the treatment, and you want to have techniques reinforce the treatment. So you need to have sort of a system to where you understand which structures, when you're working with a structure, that it's part of a particular channel. So it's reinforcing your acupuncture treatment. But it definitely is going to increase the effectiveness, reduce soreness, as Matt mentioned. You can do it pretty quick. It doesn't have to be something you spend 20 minutes doing manual techniques. You can spend just 5 minutes very quick after the treatment, and it can really bring the treatment together.
Mm-hmm.
And
Yeah,
send the patient
excellent.
out with.
And it really does help to reinforce that acupuncture treatment. It's very, very important. Thanks, Brian. That's excellent. So then also following that, it's always good to be able to give some exercises that's going to help to reinforce the acupuncture and the myofascial treatment as well. Ian, do you have any comments on that? We need to unmute him.
There you go. Thanks, Matt. I would say one for clarification, as you were discussing, when you think about the sports medicine acupuncture program, it's not just for athletes or for completely active people, although it's wonderful there. It can treat anybody who, we all move, right? So the importance of getting this type of treatment can be highly effective. And I think that continues into the exercise options that you can give for people. So this class isn't like you're lifting weights and trying to strength train. These are exercises that are really going to further encourage all what you're doing in the clinic. These, as you can see with some of these pictures here, these aren't exercises that are necessarily from the view look too difficult, but they really help to increase proprioception and continue sort of like a homework and efficacy of what you're doing. I think that a lot of these exercises too, even if you might research some of these things on YouTube or even sometimes other online aspects of looking at types of exercises like this, they seem to be easy to maybe instruct from the outside, but the little nuances and the corrections that you can make for these exercises really create a lot more efficacy within each exercise. So being able to get some hands-on tutelage and understand what sort of deviations that you're looking for from someone is important. And I think just like, all right, excellent. I might agree that these exercise treatment, the exercises and the myofascial stuff often gives you a lot of information to add to the treatment next time.
Yeah, excellent. Thank you so much, Ian. And again, it's just 2 or 3 myofascial techniques that go a really long way, and 2 or 3 exercises, which is going to be reinforcing your acupuncture treatment. And it's homework for that patient. You're holding the patient accountable, and you're managing the patient's healthcare, which is really quite important. And a lot of acupuncturists don't do as much with that. So this to us is just as important as prescribing herbal prescriptions or qigong exercises and such. And it just helps to reinforce the treatment strategy. Thanks, Ian. That's good. All right, then last, we have the assessment and treatment of injury courses in module 1, 2, 3, and 4. So in these assessment and treatment classes, this is putting everything together. The postural imbalances and acupuncture protocols, that is a standalone treatment, assessment and treatment in itself. And we can build upon that by using more orthopedic examinations, manual muscle testing, different needle techniques, acupuncture protocols that we can use for this, and PNF stretching. So we put it all together in this assessment and treatment of injury. These classes, with the exception of Module 1, are 5 days long. So we go over a lot of different injuries and we put everything together for the registrant. Module 1 is 2 days long. All right, so I think we can now start getting into some of the many questions that were pulled. And Patricia, do you want to go ahead and start?
Yes, sure. Hello, all. So, thank you all for writing in. I know many of you are not able to attend today, but we'll be watching this recording in the future. So thank you for everyone that participated and wrote in questions. I know there was quite a lot of you, so we just wanted to try and address some of the main questions that were asked at hand. The first question that I get all the time is, how am I going to be able to afford this program? And there's so many different ways to engage with this program and take this program, and so many different payment options. So I just wanted to kind of go through a few of them for you, to just give you an overview of all the different ways that you can register for the program that affect the payments. First, you can just pay per class. So if you pay per module, let's say you're coming to the all in-person classes for a module, if you pay for the module, you're going to get a module discount, but you pay at one time. If you pay per class, then you'll only pay for the PIAP and the MTT class at one time, if you're coming for both of those, and then you'll pay for the assessment and treatment of injury class at another time. And so it allows you to sort of spread out your payments a little bit more throughout that way. Again, like if you do register for the module, you'll get a module discount. So there's other ways to save by doing that. And we also offer a payment plan. So for students that are doing the all in-person track, we do have a payment plan that is available for you. You do one down payment, and then it's 15 payments throughout that 16-month period of time that the program runs. And also, because the program runs a little bit longer, it used to run about 11, 12 months, and now it's 16 months. You know, you're not getting charged as frequently as if you were trying to pay for everything within that 12-month period of time. And for students that are doing the hybrid track, something to keep in mind also is that you can purchase the online classes, again, individually to spread up the cost over periods of time. Or if you register for the entire module, there is a substantial discount for paying for all the classes within that module at one time. And also keep in mind, you have 2 entire program years, and that's, you know, right now we're on a 16-month schedule, so we're talking 32 months in order to take all the classes. So you have a lot more time to be able to spread out those payments. And you also don't need to take all the classes in order. So you can start with module 2, and maybe this year take module 2 and module 4, and then the following year take module 1 and module 3. And you can also, in addition, and I'll get to that a little bit into the next one, that if you can advance one slide.
Hey, can I add one thing, Patricia, with this?
Yeah, definitely.
There's something that you're so good at, is that with housing, that when some people want to be able to cut the cost of an Airbnb or a hotel, that we do connect you with other people that are taking that class, and maybe you can end up sharing a house or sharing a hotel room if you're interested in that. You just have to contact Patricia with that, and she can be able to set you up with it. Okay, here's the next slide.
As far as how to make time to attend the class, we know that attend the program. You know, if you're doing the all in-person track, the way it's pretty much set up right now is, other than module 1, which is 6 days, all the other modules are broken into 2 5-day segments. But, you know, so it's 5 days at a time that you would need to be able to allocate. However, one thing that's really awesome about this new program that we have, where you have hybrid and also in person, is that not all your modules need to be done in person. And so let's say you want to do module 1 hybrid. So you're going to take, your module 1, classes online, as many as you can, and then just come for the assessment and treatment and injury class. And then module 2, maybe you'll take all classes in person. And so you have many options about, how much you're able to fly in for classes. We are offering also the assessment and treatment of injury classes on 2 coasts. So for students that are doing hybrid classes, or, even if you're doing all in person, but you live like me in New York, and you go for, part of the classes in California, and then you come to the assessment and treatment of injury class, closer on the East Coast, that's also an option too. And again, you have 2 entire program years, so you can really spread things out. I think we've said this sort of over and over, but you can take everything out of sequence. So you can, again, start with module 2, then take module 4, and then the following year, take module 1, and then take module 3. So it gives you a lot more options for, how frequently you need to fly in. And I know that there are a lot of international students. We actually just had a student from Australia that just completed the program, and he did essentially the hybrid. So he did mostly online, and then flew in for the assessment and treatment of injury classes. And even before, we did the hybrid track, we had a lot of international students that were just able to spread out the program throughout the 2 years and be able to fly in and make those accommodations. So again, because it's over 16 months as compared to a 12-month program year, it also makes it a little bit easier too, even if you do want to attend everything in person. And that one thing that Matt said, being able to share with roommates, you will meet so many people your first class and connect with them. And people are really happy to be able to sort of figure out ways to be able to stay together and save some funds that way too. And one thing to note, definitely for figuring out how you're going to attend, definitely if you are planning on attending all classes within a module, we definitely recommend that you take the classes either in person, the postural assessment, PIAP class, and the MTT class before you come to the assessment treatment, or if you're doing the online route, the hybrid, we recommend that you do all the online classes before you come into the assessment treatment. It's not required. It's just more for your benefit. So you get more out of the program by being able to have really strong foundation and structure and all these things before you go into those classes. We also give you study guides to prepare about 3 weeks out before every class. We'll send you study guides so that you can sort of be prepared for the material that you're going to get at hand. The more that you familiarize yourself with, certain channels that we're going to bring up, certain anatomy and things of that nature, you'll get so much more out of the program. However much you put in is really what you can really get out of there. We can go to the next slide. So I know a lot of you, because we are doing the hybrid track. Last program year, we did offer the online. And so I know a lot of people wrote in about questions like, how does this hybrid track work? And the hybrid track, essentially what it is you will take the majority of all your classes online, and then you need to attend in person only the 4 required in-person assessment and treatment of injury classes. And that's going to be the module 1 Huatojaji, and the module 2, 3, and 4. Those are the assessment and treatment of injury classes. Those are 5 days. The module 1 assessment and treatment of injuries is only 2 days. And so essentially, once you complete the class online, you get a CEU certificate, and then you mail that to me. You email it to me, and I count it towards your certification. It's pretty simple. And again, if you are doing the hybrid track and also coming for the assessment and treatment injury classes, we definitely recommend that you do all the online classes prior to attending the assessment and treatment of injury class, just so that you also have the ability to ask questions about the material that you learned. If you're like, hey, I saw this technique, can you show that to me? With the in-person classes, especially the assessment and treatment of injury classes, we have so many assistants. So we have our instructors, but then we have a plethora of assistants. So you really have so much hand-holding and guidance with all these techniques, the myofascial techniques, with you know, the exercise techniques, with the needling techniques. So it's really a great opportunity to be able to sort of prepare yourself for coming in for the assessment and treatment of injury classes, having, you know, watched those recordings ahead of time.
Hmm.
Can
Next
we go
slide.
to the next slide? Yes, thank you.
Sometimes it's a little particular.
All right. And then another thing that a lot of people have asked, do I have to take any exams, any quizzes? You do, but guess what? They're all open book and you have like 3 chances to take them. 70 is a passing grade. What I find, you know, as someone that's gone through the program, someone that's been around the program for a long time, these quizzes are an awesome opportunity for you to kind of like get all your notes together, get your sort of like mind and flow and get everything organized. So as you're taking the module, the module quiz, it kind of also gives you an opportunity of like, hey, what do I need to ask some questions on? What do I need to study up on a little bit? So I find them super, super helpful to be able to have this sort of check-in for myself of like, hey, what can I spend a little bit more time, or what did I really not understand? So the module quizzes are for anyone that completes all classes within a module, whether in the all in-person track or the hybrid track. Still, they're relevant for both. And then you have one final practical exam, which is really once you're done with all your coursework and your quizzes, you pick really a random case and you meet with us and we kind of go through that case, and you know, you walk us through your assessment, your diagnosis, your treatment, what kind of exercise prescription, what kind of myofascial things that you might throw in. We give you study guides for the final exam. So again, no stress, that we try to really set you up so that you'll be in a really good place to be able to take this exam and do well.
One quick note on that final practical exam, because that is live and some people it's kind of a nerve-wracking thing. We try to make it as comfortable as possible. And the people that really, really succeed at the final practical exam are those people that are applying the techniques and using it in their clinical practice. When you're using it in the clinical practice, because the final practical exam is clinical, they have no problem in passing this examination. So this is something that we support people 100% with this, and we're really hoping that everybody can be able to pass with that. And we give many different study guides, and we answer a lot of questions with that. Okay, next slide, Patricia.
Yes, please. Something else that people have been asking is, are we hosting any classes on the East Coast? As Matt alluded to earlier, we are, you know, the entire 23-25 SMAC program is all going to be in San Diego. So all the in-person track will be offered there, but the 4 required in-person only assessment and treatment of injury classes, the ones that are required whether you're doing hybrid or all in-person, are also going to be offered in Bloomfield, New Jersey, as well as the 3-day cadaver labs, which again are optional, but definitely recommended. Those are being offered in Florida. So we do try to offer it, you know, as much as we can. We understand that, you know, there is a commitment with flying and time and things like that. So at least for that course and for the 3-day cadaver labs, we're trying to be able to offer them in different cities. So if you're on one of those coasts, it might be a little bit easier for you to be able to get there. Next slide, please. Another question that came up was about job placement opportunities. You know, once you become certified as an SMA practitioner, we add you to our directory. And as someone that, again, hosts so many emails and gets so many phone calls, a lot of people are always calling and saying, hey, I have this injury. You know, do you know anyone? Just from because we are who we are, like because of the training program that we do. And so I always refer them to this directory. So there's a lot of people. I mean, every single week I am directing people to our practitioner directory to be able to get resources and to be able to find practitioners that are certified through us. Also, this training is really unique, and the skills that you get from this are going to make you, if you are looking to work for a larger organization, much more marketable. It also, many of the other students that, you know, you'll meet a diverse, as Matt was saying, like there's people that are coming in that really specialize in OBGYN. We have, practitioners that are participating in the program that are already working with professional athletic teams. We have people that are working with, weekend warriors. We have everything and in between. And so if you're looking, to be able to get a job placement, whether in some sort of like multi-practice clinic with, chiropractors and physical therapists, or work in a hospital setting, or work with a professional team, you're going to be able to also be able to network with a lot of other acupuncturists that might already be in that environment and be able to give you the resources. Also, once you're certified as a CMA, you're invited to our private Google group. And in that group, it's always being, there's always things that are coming up, different cases that we're being able to present for one another. And again, like if you're looking really for job support, it's also a great opportunity for you to be able to post to your fellow CSMA practitioners, hey, I'm in this city, I'm really looking for this, that, and the other, or I'm trying to get this sort of job with this sort of environment. Anyone have any thoughts or insight? And so I find that our Google group and, even just being on that practitioner directory already is going to be building business for you, let alone the amazing skills that you're going to be getting, which are really unique through this program.
Can I add something on that? Because I feel like there's so much opportunity in terms of the verbiage and the language and the anatomical understanding you get from this program that allows you to really be on the same page with any type of multidisciplinary therapist. I work in a clinic where I'm working with chiropractors and strength and conditioning people and manual therapists, and I can speak their language fluently. And I think this program is distinct in how well it helps you be able to do that. And that in the practitioner directory, I use that all the time. I have, patients who maybe high school students are going to college and they need some people or moving, and I use that all the time. It's such a great resource to be able to send other therapists, acupuncturists, know that your patients are in good hands and be able to describe it and communicate about the different cases that you have as they go to them. So it's such a helpful program in that manner. Just want to add that.
Yeah, thanks for saying that. That's a common comment that we have in our reviews about that, actually learning this language and how to be able to communicate with other professionals. So I'm glad that you brought up that point. Thanks again. All right, so it looks like the next one is a number of different questions that were asked, and I wanted to go through these step by step. How do you integrate SMAC with other systems of acupuncture? Just depends on really the other systems of acupuncture that you're using. For example, we have actually quite a few 5 elemental acupuncturists that come to the SMAC program, which is really quite interesting. And that combination of changing energetic blocks with the 5 elemental acupuncture, in addition to the traditional Chinese medicine-based SMAC assessment and treatment techniques, again, of course, it's orthopedic based as well, is just a natural transition between the two. And this is also going to be something that the practitioner themselves, is going to start to be able to figure out what they can glean from the SMAC program and add to their particular practice as it exists. And this is something that we're very, very happy to discuss the different strategies with that. Next question is the idea that after going through SMAC program, you would become a specialist in physical medicine. Well, I think you could probably say that you're pretty darn good at physical medicine. It's up to you if you want to use the word specialist or not. We do say specialist in sports medicine acupuncture. That is something when you graduate as a C.SMA, which has gotten to have a very good reputation, you will be a specialist in sports medicine acupuncture. You're going to be learning postural quirks, postural imbalances, how to be able to correct those with acupuncture, not just local points, but adjacent and distal points, therapeutic exercises, myofascial techniques. So there's a lot to this program. Do you see internal medicine patients as well? Absolutely, because by treating the external, it helps the internal. By treating the internal, it helps the external. For example, I have a patient that I'm treating right now that has an L4 facet joint arthrosis that is mimicking sciatica like patterns. So the pain's going into the butt and into the hamstrings. It's not disc related because they have a negative straight leg raise and slump test, but a positive stork standing test and yeoman's test and 2 palpation to the L4 facet joint, at least above it, causes quite a bit of pain. So I think that diagnosis is pretty accurate. But you know what's interesting about this patient? They also have diverticulitis. And so with the large intestine, back shoe point being at the same level, L4, by ignoring the internal environment would just not be doing this person justice. And so we don't treat just the meat suit. We have our TCM hat on, we have our sports medicine hat on at the same time. So treating both sides of the body, yin and yang sides, and definitely observing TCM with this. Next, do you strictly employ techniques from SMAC when seeing physical medicine patients, or do you still incorporate classical Chinese medical theory? Yes, I think I answered that actually with the previous one. Any comments on that? With that, Ian or Brian, anything to add? You guys frozen up or
Nothing here.
I freeze up? Okay. Trying to get in. Looks like I'm having a bit of a Wi-Fi problem. I'm not hearing you guys. Did you answer?
We were muted, Matt. No, it's good. I think you answered it.
Okay. All right. Good. Next question. During the assessment and treatment classes, will there be ample opportunity for practicing deep needling techniques? Yeah, for sure. And we're looking over your shoulder. Just like what Patricia was saying earlier, we have a lot of different assistants, and these are hand-picked assistants. These are the cream of the crop CDOT SMAs that are invited to come back in and help us out. So they know the techniques very, very well, and they are an extension of what we are teaching. So absolutely, there are some needle techniques that definitely need supervision, and we do not allow anybody to be able to practice these techniques on their patients until they are sufficient in the classroom themselves. So it's not all about deep needling either. I mean, right? So there are some points that, of course, you want to go to the bone, and there's other points that you want to stay in the superficial fossa, in the subcutaneous fat region. Just depends on what the target tissue is and what level of chi we're trying to be able to tap into. Let's see what else we got. I've been using comparatively shallow needling technique. I'm not proficient with the technique scrape the bone or pass through the muscle layer, such as that used for the popliteus bone or the motor point. Again, this is going to be something that we are going to be holding your hand through this. This is not uncommon to be able to have students come in that needle the Wato Jiaji points just past the skin or other points just past the skin, which is effective, but there are going to be conditions where needling to a particular target tissue in order to regulate it, not necessarily reduce excess, but also to tonify deficiency, depending on the situation. This is the language and the thought processes that we use, trying to be able to get the stimulation of that level of anatomy, in addition to complementing that target tissue needle with adjacent and distal points, because acupuncture is a signaling system. All of the needles should be talking to one another, and this is what we teach. Every single point that you're using should have an intention and a reason why you're needling that particular point, and is it linked with other points? Because as we know, points can change myofascial tension, and that doesn't have to just be a motor point. It could be a Luo point, it can be a Shiclef point, it can be a Jingwell point. The art and the skill of a comprehensive acupuncture treatment is to know how to be able to link different points on the yin and yang side of the body. And this is something that I believe that we excel in.
And Matt, can I say one thing to that too, is that's where I think, with some of these questions about deeper needling and shallow needling and the needle depth, that's where I think some of the things like the cadaver lab are just so useful. And also like why we're using certain distal points. Like once you see on the cadaver, like the different lines of pull, and when we're pulling a muscle that might seem like it should be on GB channel, but it actually really belongs on UB channel. And how those interactions are, it just sort of opens things up for you. And when you actually participate in the cadaver lab, whether either watching it online or coming to the cadaver dissection, being able to appreciate the different depths of things so that you really understand, like, it's not, again, all about just like having to go super deep. It's about understanding the different layers. And I think like the cadaver portion of this program is one of those really unique opportunities that, you know, we offer to be able to understand why the depths are the way they are. So I just wanted to add that in.
Yeah, thank you for that. And then the last one, unsure of how to integrate with existing knowledge. This is something that will just need to be practiced in your practice. We are going to be teaching you step by step, very specific techniques on how to be able to do certain things. But, you know, because you are an acupuncturist, you are a human being that has been practicing for either a year or maybe 20 years. You're going to have your own way of processing the information, and how are you going to apply this information, these pearls, these innovative approaches with your own existing knowledge. And it's totally fine to be able to change the step-by-step process. We're guiding you in a certain way on how to be able to learn it, how to be able to apply it, and how you modify it. This is your practice. This is how you can be able to excel in modification and treating the patient, because that's really what it's all about, is helping other people and getting people out of pain. It's rewarding. It's fantastic. So we're not really strict and adamant about it. You have to do this in a very particular certain way, unless other than maybe some of the very specific needle techniques because of safety reasons, right? But as far as integrating some particular points, gosh, there's lots of different points to be able to choose and different ways of doing things. So anyways, hopefully that answered your guys' questions. I know that Brian and Ian might have to get taken off here really soon. This is the end of our PowerPoint, but if you guys have any questions right now at all, Autumn, maybe you can be able to field them, and Patricia and I can be able to answer them. So Ian and Brian, thank you so much for coming. You guys really, really appreciate it. You guys have been awesome.
Yeah. Thanks, guys. Have a great Sunday.
Yeah, have a good class, Brian. Ian, are you able to hang out, or you got to take off?
Yeah, I can be here a couple more minutes. I'm fine, just to see if there's any questions that I can help with. But
oh, right on. Thank you very
thanks for
much.
having me. Yep.
Okay, cool. Are there any questions that you guys have for us?
I don't think much stuff has come up in the chat. So I think, you know, a lot of people had written in. So again, just to reiterate, you know, we are going to post, in case you came late to the Q&A, we will post the recording of this. We will post the notes from our PowerPoint information. And as always, you can definitely reach out to me. I'm always happy to get on the phone or on email with you. All of my contact information is located on the SMAC website. So please just let us know how we can help, and if you have any other questions.
Patricia, did you want to comment on anything about registration?
Oh, yes, definitely. So our registration, we are currently, registration should definitely be open for this program. Definitely by Wednesday, the latest. There has been, we are sort of reprogramming the website a little bit. So if you see that there is the registration page for the online portion classes is inaccessible, it should hopefully be online this week. And if you have any questions about anything or want to register manually, just let me know. Again, just email me, reach out. I'm always happy to either get on the phone with you or communicate via email.
Awesome. Thank you so much. Really, really appreciate that. Autumn, thank you. Patricia, Ian, you guys have a great day. Everybody have a great day. And we'll talk to you again.
All right. Thank you.